Welcome to the Political Checkmate, and today I am going to checkmate Obama on Obamacare. I am going to show my criticism of Obamacare, but before I begin, I agree that the healthcare system is incredibly flawed. I personally am more support of more free markets in healthcare by first doing a four-step healthcare solution proposed by economist Hans Hermann Hoppe and getting rid of patents and more mutual aid societies.
It's been 10 years since we passed the Affordable Care Act. With your help, it's the closest we've ever come to universal coverage in America. There are people alive today because of what you did. There are 135 million Americans whose pre-existing conditions are now protected because of what you did. Young people who've been able to stay on their parents' plans, seniors who've had an easier time affording their medicine, women who can't be charged more just because they're women, and a lot more. That's something worth celebrating, but it's also
The best statistical estimate on lives saved by Obamacare, according to economist Orrin Cass, is 0 lives. The reason is because of a flawed concept that having coverage would lower mortality rates. Orrin Cass points to states that have expanded Medicaid in the 2000s, having mixed results, such as New York having reductions in deaths, Arizona statistically insignificant reduction, and Maine having a statistically insignificant increase, so very mixed results. While mortality from 2014 to 2015 declined with 80,000 deaths, which show that Obamacare is not that significant if it could not decrease mortality rates. In fact, multiple peer-reviewed studies have found that insurance coverage does not decrease mortality. A study from Richard Health Service Research found that health insurance coverage for all adults would not have a large effect on the number of deaths in the United States. Another study from the New England Journal of Medicine looked at the Oregon expansion of Medicaid and found no significant improvements in measured physical health outcomes. This study from the Journal of Public Economics looked at the Affordable Care Act Medicaid expansion and found that using county-level data, there was no statistical significant evidence that the Affordable Care Act caused declines in mortality for Medicaid expansion states. This study from the Southern Economic Journal found that using a 5% significance level, there is no evidence that Medicaid expansion affects any outcome in any of the treated states.
progress worth protecting. You helped protect it with your vote in 2018. But even with a House of Representatives committed to building on the Affordable Care Act, Republicans will keep trying, both in Congress and in the courts, to rip away the care that millions of Americans rely on and to raise costs for millions more.
While on pre-existing conditions, a paper from the American Economic Association found that Obamacare damaged the health insurance market by making it unattractive to people who have costly health conditions. This is because Obamacare has made it more expensive for insurers to insure people because of a patient who filed $61,000 claims. The insurers will only get $47,000 to cover the patient under Obamacare, which would make it insurers penalize themselves with an extra $14,000. This has caused a lot of high-quality coverage offered by insurers to be penalized for it. I am now going to read a quote from the Wall Street Journal talking about the study. This study also corroborates reports that these rules are subjugating patients to higher deductibles and cost sharing across the board, nearing networks that exclude leading cancer centers, inaccurate provider directories, and OPOC cost sharing. A coalition of 150 patient groups complained this government fostering race to the bottom completely undermines the goal of the Affordable Care Act. It doesn't have to be like this. Employer plans to offer drug coverage more comprehensive and sustainable than Obamacare. The pre-2014 individual market made comprehensive coverage even more secure. High-cost patients were less likely to lose coverage than similar enrolls in employer plans. The individual market created innovative products like pre-existing condition insurance that for one-fifth the cost of health insurance gave the uninsured the right to enroll in coverage at a healthy person premiums if they developed expensive conditions. Now, with healthcare costs, a study from UPenn found little evidence that the Affordable Care Act cost containment provisions produced changes necessary to bend the cost curve, but that its coverage expansion produced a predictable jump in healthcare spending. While this study from Health Affairs found a cost savings provision has not sustained and the coverage expansion has increased overall health spending. I want to personally include another negative of Obamacare, which is economic growth. And to quote huge Chicago economist Casey Mulligan, based solely on recent economic growth, the Affordable Care Act has subtracted $250 billion from GDP. The incentive changes embedded in the Affordable Care Act based on past incentive changes are expected to also reduce employment by 3% and GDP by 2%. That would be about 4 million jobs and more than $300 billion per year. This is the end of the video. Thank you for watching, and please donate to my Patreon so I can make more videos and have your video requests checkmated. And thanks for watching, and have a nice day.